It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following: causes of bloody diarrhea in dogs. Unfortunately, bloody diarrhea in dogs is a common cause of visits to the vet. We recognize it by our dog's frequent trips outside, which usually result in watery, mucous, or sometimes bloody stools. If your dog has diarrhea and you are concerned about the presence of blood, contact your veterinarian and pay attention to the following information about possible causes. What should I keep in mind if my dog has bloody diarrhea? If you notice blood in your stool, it is important to differentiate between fresh blood, bright red streaks or spots, and digested blood, often dark or tarry stools. Fresh blood is usually produced in the large intestine, while digested blood is indicative of bleeding in the stomach or small intestine. Stool colors is a helpful guide. Causes of bloody diarrhea in dogs. In theory, anything that causes diarrhea can also cause bloody diarrhea. We will talk about the most common causes of diarrhea. From this, we will analyze which of them are most likely to cause or lead to bloody stools. 1. Irritation of the large intestine by foreign and indigestible materials. Indigestible elements that pass into the large intestine are transformed into feces. These items pass along the large intestine and, particularly if they have rough or sharp edges, can act like sandpaper on the lining of the intestine. In some cases, this indigestible material causes bleeding inside the intestines. This is usually seen in the form of red streaks or spots in the dog's stool. When small amounts of loose, bloody, or mucous stools occur, a condition called colitis is diagnosed. Although this diagnosis can have various causes, the most common is irritation. Luckily, this is usually corrected with a bland diet and sometimes with medication prescribed by the veterinarian. 2. Inflammatory bowel disease. Inflammatory bowel disease can also cause colitis symptoms. However, these symptoms frequently reappear or may not respond to standard treatments. Inflammatory bowel disease can be triggered by the body's own immune system or by a food intolerance. 3. Parvovirus. Parvovirus is a serious viral infection that usually occurs in unvaccinated puppies. It causes bleeding in the intestines and often causes digested, dark or tarry, blood to be passed. It is a serious disease with a high mortality rate and veterinary treatment should be sought quickly. 4. Rectal polyps. Rectal polyps are usually benign and can be treated with surgery, but they can cause streaks of fresh blood in the stool. The blood does not respond to standard diarrhea treatments. 5. Tumors. Tumors of the small and large intestine are rare, but can certainly cause bloody diarrhea, both types. 6. Medications. Some medications, prescription and over-the-counter, can cause irritation and bleeding in the stomach or intestines. Care should be taken to examine the stool regularly if your pet is taking anti-inflammatories or antibiotics. Although bloody diarrhea can be alarming, it is usually treatable with some simple remedies. Always consult a veterinarian if your pet has diarrhea, with or without blood. When to worry. Most cases of colitis improve on their own within a day or two. However, there are times when you should worry and seek help as soon as possible. Severe diarrhea. With or without blood, severe watery diarrhea can quickly lead to dehydration and loss of important minerals, especially if vomiting is also present. Is your dog happy or unwell? You know your dog better than anyone. If he seems cheerful, happy, and awake, and is eating and playing normally, you can probably wait a day or two and see if things improve on their own. However, if your dog seems lethargic, cries in pain, or stops eating, then you should go to the vet. How long has it been? Even if your dog seems happy and is feeling well, if the bleeding continues for more than 48 hours, it is best to have it investigated. Was there an event that started it? Always try to think about the last few days before you see blood for the first time. Has your dog eaten a bone or stolen food from the trash? Have you used any toxic substances in the garden that he may have found? Also ask your neighbors. Have you suddenly changed your dog's food? If you decide you need to go to the vet, it would be very helpful to bring a stool sample. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.